the semilunar valves, of course, are closed, because the pressure in the ventricles is less than the pressure that are in the aorta and the pulmonary trunk. Uh-oh, there we go. Now I'm saying a lot of words here, and I realize that. You can pause me at any time, read it for yourself. You're going to have to look at the pictures to dig out the best information here, or to make it real to you. Because it can be confusing, but it doesn't have to be. We'll go over it more and review it, and please ask questions. So, one cardiac cycle. The atria contract while the ventricles are relaxing, and then the ventricles contract while the atria are relaxing. Pause, do it again. So, we know that the SA node starts the atria message. The first step in a cardiac cycle is then when the atria contract to push the blood into the ventricles. When the ventricles receive that blood, it's called the end diastolic volume, or EDV. Essentially what that means, that's the amount of blood that the ventricles receive from the atria when they were chill. Okay, they're just chilling, and the atria's like, here's the blood. So that's how much it receives. The next step in the cardiac cycle is called isovolumetric contraction. Big word. Let's notice the major things that are happening. The ventricles are contracting. It's going to then increase the pressure in the ventricles. What will happen because the pressure increases, the AV valve doors shut. That's the first sound in the heartbeat. But the pressure in the ventricles isn't high enough to open the semilunar valves. So both valves are shut, and pressure will then increase. The next step is the blood has to get out of the ventricles. So they'll go out, and the valves are open, the semilunar. And the amount of blood that comes out of the heart is called the stroke volume. The amount that comes out of the ventricles or out of the heart every time it beats. Not all of the blood comes out of the heart every time it beats. Some remains in the ventricles. This is called the end systolic volume. Remember, systole is contraction. So the amount of blood that's in the heart after it contracts. There's an equation to figure this out too. So you take the end systolic volume, how much is in the heart after, you want to know how much stays in the heart essentially. You take the amount that goes into the heart from the ventricle or from the atria, which is about 130 milliliters. You subtract the typical stroke volume, which is 70. That's how much comes out every time the heart beats. And that means that about 60 mils of blood stays in the ventricles after they contract. So the ventricles have contracted. They've moved the blood up into the aorta and the pulmonary trunk. Now the ventricles relax. And they start to expand, which decreases their pressure. The pressure in the arteries goes up. The second sound of the heartbeat, the semilunar valves shut. AV valves are closed. So both valves are closed during isometric relaxation. The blood isn't moving, and everything's chill. Next, the atria are relaxed. Atrial blood pressure forces AV valves open, and then the ventricles start filling passively with blood. Semilunar valves remain closed. AV valves open. This is all of that in picture form. We'll practice this. First step, atria contract, pushing blood down. Pressure's greater here. Atrial pressure is greater than ventricular pressure. Okay, AV valves open, semilunar valves shut. Next step, isovolumetric contraction. Pressure is starting to build, but the valves are shut. The AV valve shuts, boom. First sound of the heart. More blood is in the ventricles. So the ventricle pressure is above the atrial, but it's still less than the atrial trunk pressure. Next step, pressure builds enough to open those semilunar valves and blood goes out of the heart. Ventricles are contracting like a go-gurt. Notice that the AV valve is shut over there. Next step, semilunar valve shut. Second sound of the heart, because pressure is higher in the vessels. Atrial trunk pressure is greater than ventriculars. Blood is coming back to the heart. AV valve is open. Blood starts filling the ventricles. Next step, everybody's chill. And then it starts again. Oh wait, I went the wrong order here. Like that, yeah. So that's just a confusing picture. 1, 2, 3, 4, 5. The amount of blood that leaves the right side of the heart and the left side of the heart needs to be equal. Or else swelling can occur in different parts of the body. The left side or wall of the heart needs to be thicker in muscle because it has to push blood further to the rest of the body. So that's why the left ventricle is thicker. It has to generate more force. But the amount of blood that comes out of the left side and the right side is actually equal. And remember, some blood, the end systolic volume stays in the ventricles after they contract. Look here, you can see it there. This is in order, that's better. After they contract, and then more blood will fill. So what happens if somebody's heart gets bigger over time? Essentially, their heart is holding too much blood. Their end systolic volume is too much. So it starts getting bigger. And then it's a less effective pump. This is a picture that if it helps you, good. If it doesn't, I would not even pay attention to it. It shows the pressure differences in the aorta, the ventricles, and the atria, and then the volume of blood within the ventricles, okay? Down here, just ventricles. So this saying the first 3 steps, blood is starting to fill the ventricles. And then it gets to the ventricles. That's the end diastolic volume. Then the ventricles contract, pushing out blood, stroke volume. So you see how the volume goes way down, but there's still a little bit in there. That's the end diastolic volume. Then blood starts entering the ventricles again, and so on and so forth. And this is the pressure differences between the atria, ventricles, and the aorta. Cardiac output is essentially how much blood comes out of your heart every minute. And it's measured in liters per minute. And it measures how effective your heart is at transferring blood. So you can have higher cardiac output, lower. Things that affect this are exercise, age, things like that. And to determine cardiac output, you multiply stroke volume, which is about 70 milliliters per beat, times your heart rate. So the average per minute is about 5.25 liters, or your entire blood volume. Cardiac output goes up if your heart rate goes up. It goes up if your stroke volume goes up. It goes down if your heart rate goes down, and it goes down if your stroke volume goes down. So if you're a better athlete, you're going to have a lower, higher cardiac output, depending on the situation. I know when you're working out, your heart rate goes up, right? So that's going to increase the cardiac output, or the delivery of oxygen-rich blood to your cells, and then it goes back down quickly, back to resting. The cardiac output must meet the tissue needs of your body. We're almost done. So individuals that have smaller hearts have smaller stroke volume because they don't need to get as much out because they're smaller distance to get the blood there. So to equal appropriate cardiac output, they need to have a faster resting heart rate to get the cells in their body adequate blood. So women, for this reason, and children generally have higher resting heart rates. Okay. Individuals with larger hearts have larger amount of blood that comes out of their heart every time it beats. So therefore, their resting heart rate is usually lower because the cardiac output usually is about the same. Athletes have larger and stronger hearts. This is showing a picture of the fetal heart. I wanted to show it to you. This is about week 7 or 43 days. You don't want blood to go to the lungs because the lungs aren't fully functional. So in the fetal heart, there's a bypass, a few bypasses that allows blood to not go to the lungs. So the first is called a foramen ovale, and this is the right atrium. This is the left. It's a hole that instead of pushing blood to the right ventricle and then to the lungs, it pushes it to the left atrium through this hole and then out to the rest of the body. So that's an example of how your fetal heart is different than an adult heart. It bypasses the lungs. There's a hole in between the atria to prevent it to go to the lungs. And this is just that in word form. The remnants in an adult heart of that hole are still there because when it'll go away. That hole doesn't exist, or it shouldn't exist, because then they'll need pediatric cardiac surgery, because some people still have holes in their heart, and then they need to be repaired because it prevents it causes inefficiency in the delivery of blood to the parts of your body that need it.